You've built a successful life, but now what? Welcome to the Gen X Collective podcast. We're for men who are navigating midlife with purpose, health, wealth, family, work, and the mark you've made on the world. We're talking about the stuff that really matters with experts who have solutions, advice, and a sense of humor. And now, here's our host, Laurent Truc. Welcome back to the Gen X Collective podcast. This is your host, Laurent Truc. Today, I'm joined by Dr. Sharif Hassan, an internationally trained internal medicine physician whose career spans critical care units in the UK to leading-edge precision medicine practices in the US. A former intensive care doctor, Dr. Hassan's journey took a dramatic turn after a mysterious illness forced him to rethink everything he knew about health. What he discovered was the central role of inflammation. Today, he designs cross-border health optimization programs that integrate genomes, lifestyle, and advanced diagnostic, helping patients worldwide take control of their health like never before. Sharif, welcome to the podcast.
Thank you for having me, Laurent. I'm really excited and happy about this opportunity, especially following the same age group. And a lot of people are not aware that Gen X men, in spite of advancements of technology and changes in the lifestyle, still health presents a challenge to them more than their previous generation, their parents, the baby boomers. They seem to suffer less health-wise than their offspring or children who are the Gen X men.
Interesting. Well, I have to say, we just had our event a couple of nights ago, and a lot of topics of discussion around men's health. So I think this is perfect timing. And I think inflammation is something that people don't talk a lot about. And I'm excited to have you, and I'm excited to learn from you today.
Thank you.
Would love to start from the beginning. So you were in intensive care medicine. Like, what led you to that originally?
I found it actually the most challenging specialty within internal medicine. I meant you're dealing with people there trying to prevent them from going underground. It's very complex and multifactorial. They might have something wrong with their heart, their lung, their kidneys might be failing. They might have overwhelming infections. So as always, I love challenge. I went into that field.
So you knew from the start when you got into medicine, this is what you wanted to do?
Definitely.
Very cool. But then that's changed over time. So can you tell us a little bit about your story from when you were in that field to kind of how it's formed you today?
Yeah, actually, my last job in the UK was an intensivist in a heart and lung transplant unit. And we had severely ill patients who came not only from all over the UK, but Europe as well. And I found myself, in spite of the fact being very well trained and competent in handling situations like these, in addition to advanced machinery like life support and ventilators. But I started to think at that time, what would prevent human beings or patients from getting at that stage? What can be done to prevent the crisis rather than treating it? And that feeling carried along with me until I came to the US. What I can do better as self-improvement, self-exploration, how I can be more beneficial, not only to the patients, but for myself. So I started to think at that time, what can I do to shift my focus on prevention rather than acute treatment? Although up to the moment, I'm heavily involved in treating very sick patients, not in the hospital, but in coordination with hospitalist groups in the hospitals that I work with.
One of the things I opened up with that you and I had talked about beforehand was you personally were ill with a mysterious illness, and it kind of changed a little bit the course of your thinking. Can you get a little bit into that?
It changed a lot, actually, because after that, I was at that time solely hospital based. I started to feel exceptionally tired and inextricably tired. I had muscle aches all over, ringing in my ears. I found that I had blurring of vision on and off. It was totally unexplained, and it was episodic. So initially, I was misled by the thought that I'm overexerting myself because I'm used to work, work, work. I get sick or have a flu or a cold or some sort of an ailment that will keep me from work. But actually, that condition gradually got significantly worse in the sense that I started to feel bloating, tummy pain. I had laparotomy twice, actually, which is abdominal surgery to when I had intestinal obstruction. And they couldn't find a reason, in spite of the fact this being carried out in the best medical centers around here, like Johns Hopkins and Innova Fairfax. They couldn't find a reason. And I was discharged on these two occasions after one of them taking out my appendix, although it wasn't inflamed, because all they could find is just inflammatory fluid within my tummy, but nothing else. So they thought rather than me having another surgery just because of appendicitis, they would go ahead and just take it out.
We're there anyway.
Yeah. So I left the hospital, but after that, I found myself having really bad joint pain. I thought at that time that I had gout, ran a uric acid test, x-rays, nothing was wrong. Even trial of gout medications did not work. And a year after that, I just missed two steps and I ended up with severe left knee injury whereby I had a torn ACL and both menisci were torn. And the surgeon who had done the repair was asking me, did I play any sort of competitive sport before, like football or rugby? Because my knees were really fried. And I told him no. Actually, even till now, I don't know the rules of American football. So I had the repair surgery and had a very, very slow recovery. But then after that, I continued to have not only the abdominal symptoms, I had something else, really bad bone pain, as well as symptoms of an inflamed prostate. And what scared me at that time is that when they ran the PSA, the prostatic specific antigen, it was elevated. And my late father at that time was being treated for prostate cancer. So it got me up right.
Sure.
But to cut a long story short, I was puzzled by all of this. So I spoke to a friend of mine in Germany, actually. And Germany and Austria, especially in the rural areas, they have what is called a rural doctor, the one who's more holistic into supplements, lifestyle, and so. I spoke to one of them and he actually attracted my attention to the relationship between eating certain things and being in some specific environment, hospitals, or when there is musty air. So we started to make the connection between actually mold and what I had. And eventually this was the case. It was definitely mold, resulting in what is called SIRS, or chronic inflammatory response syndrome, which is now known as just chronic inflammation, because it turns out that this is not caused only by mold, but it's caused by a different myriad of things.
So this doctor, or this person in Germany, kind of brought you to the realization it could be that. How did you actually put it together? Did they run tests to verify that you had high inflammation and the inflammation was caused by mold?
Yeah, I ran tests myself at the beginning. All I had was abnormal, was a low chloride. That actually designates dehydration. Nothing otherwise. All the other markers were okay. So I wanted the esoteric test way, in the sense targeted some really specific, rarely done inflammatory markers that were elevated. And once I went to what you call to the environmental test, and done tests on the hospital or where I was working at the hospitals or clinics, it turns out they had a significant mold count, actually.
So can you help us understand, like, what is inflammation?
Inflammation is an autoimmune response to any adverse injury, be it infection, um, surgery, uh, or even trauma. But it's usually actually infections.
And are we always living with some amount of inflammation, or like, are you talking about acute inflammation?
What traditional Western medicine is used to is inflammation caused by infection resulting in pain, redness, and swelling. This is not the case with the inflammation that I had, that is mostly silent or low grade, chronic. It just shows very, very much later on after several years of exposure. And that's what had happened with me. I started to have symptoms like several years actually of being exposed to that on and off, because it wasn't at my home, it was in my workplace. And I wasn't
Mhm.
working always in the same place.
What are some of the symptoms? Because I know you and I talked, and as you were telling me some of the symptoms, there are days that I feel that all the time. It's like fogginess. So help us understand so that somebody knows whether inflammation could be a cause of what they're feeling, or if it's just they're getting older. Like, what does that look like?
Yeah, inflammation is inflammatory particles circulating in the bloodstream. So it depends on wherever they hit, you're gonna have the symptoms. If they affect the eyes, you get blurring of vision, you get less sensitivity, visual contrast. If it affects the ears, you're gonna get ringing in the ears. It affects the brain, which is most often you're gonna feel foggy brain, mental fatigue, tiredness, headaches. And also, if doing it affects the nervous system, you're going to have severe nerve pain or neuropathic pain. Among the neurological symptoms, as an example, if they settle around the basal ganglia, they can cause symptoms like Parkinsonism. I had few patients like that, actually. They can cause similarity with even MS. When they hit the heart, which is very often, people get chest pain, shortness of breath. I actually, when I had this disease, one of my cardiologist colleagues was trying to convince you to have a heart cath. It can result in palpitations. When it affects the muscles, and this is mostly the case, it leads not only to inflammation of the muscles, but the fascia, which is the thick tissue around it, leading to a lot of muscle aches and pains, back pain in particular, psychological as well, because of all what is happening and the individual wondering about what's wrong. It can lead to an anxiety and lowered mood.
And you can have an inflammation that impacts all these things.
Exactly.
Like, it doesn't have to be localized. Just because you have a knee problem doesn't mean only the knee was inflamed.
Exactly.
Okay, got it. Can you talk a little bit about like inflammation that's commonly overlooked today? Like, what could create that in our bodies?
What creates that in our bodies is actually exposures, poor lifestyle, poor diet, a lot of these controllable factors. The only thing that happens there, which you can control somewhat, it is the natural aging process, which is actually inflammation. That's why nowadays we use anti-inflammatory medications as anti-aging, things like colchicine, what's used for gout. And that's what I tried to use when I had the knee pain and it didn't help at all. We use things actually like low dose rosuvastatin is one of the statins for cholesterol control because of its anti-inflammatory properties to slow down the aging. Also, a medication like ivermectin, which is an antihelmintic agent. It's like a tablet or a medication against worms. Actually, it's got very good anti-inflammatory properties to the extent that they use it as an adjuvant for treatment of breast and lung cancer now.
Is there a protocol for each type of inflammation? So if you get inflammation because your diet is poor, is there a specific medicine for that, which would be different than if you get inflammation from lack of sleep or some other environmental stress?
No, it's controlling these risk factors or controlling the causes. As an example, if it's poor diet because you're eating too much of sugars that cause insulin spikes, that's pro-inflammatory, or if you're eating refined sugars, refined carbohydrates like refined flour or so, that's lacking vitamins and fiber, you control these things. We can go by them one after another. I mean, this is the diet. A quite often overlooked factor of inflammation is actually stress. Why? Stress works on what you call the hypothalamic pituitary adrenal axis, which can lead to activation of cortisol, and this in turn causes inflammation. Lack of sleep, and actually whether lack of sleep as time-wise, duration-wise, or quality, can send like an inflammatory wildfire all over the body. There is environmental factors as well, including air pollution, heavy metal exposure, pesticides and chemicals. Sedentary lifestyle in its own right actually can cause inflammation. Why? You tend to accumulate visceral fat, and visceral fat is pro-inflammatory through it creating insulin resistance. Also, chronic infections, like I have mentioned, H. pylori, I meant this bacteria you can find in most people who've got gastritis or acid reflux. And not only in the long term can it result in stomach problems, but it can lead to inflammation all over the body and can result in this as well. And the other common example is the Epstein-Barr virus that so far traditional Western medicine is not linking it to a specific disease. Sometimes they link it to lymphoma, the other times they link it to HLTV, which is similar to AIDS. But what appears the case to be is that it's involved in inflammation, low-grade inflammation, and atherosclerosis, which is hardening of the arteries in all the cases involved. Also, exposure to environmental disruptors with the technology that we have now and all the plastics, especially all the BPA, is a huge thing. And surprising to most people, actually, it affects fertility and reproduction more than anything else. Also,
because of inflammation? So
yes.
it causes inflammation, inflammation causes infertility.
Yes, exactly. But mostly directed towards the reproductive organs, actually.
Okay.
And that's why you find a spike of infertility and the late age of having children nowadays, especially in the Gen X and generations after that in comparison with the older generation. One very commonly overlooked factor that leads to inflammation is leaky gut. We were taught in medical school that the major immunological system of the body is actually the bone marrow through the production of the red cells, immunoglobulins, and so. But this is not the case. It's actually the gut. The gut, which is with its own microbiome, it drives the genetic code and can help producing antibodies and is actually the major immunological system of the body. So when you have something that results in inflammation and results on separation of the space between the cells, then in this case, foreign bodies, especially from the food, from allergens in the food, can get into the bloodstream and cause a lot of inflammation. Also, we got to look at food sensitivities, not allergies, whereby food allergy results in an immediate response of inflammation, bronchospasm, wheezing, or difficulty breathing. But food sensitivity can result in low-grade inflammation, which can manifest like any of the things that I described before. Also, leaky gut is heavily affected with the use of antibiotics, painkillers, antacids, and surprisingly, some of the things we use every day, like as an example, in dishwashers, when you use excess soap or it's not washed properly with water, or when there is remnants of jet dry, the chemical agent responsible for drying the dishes. This all can result in leaky gut. And with technology, of course, exposure to EMF and what is happening with the processed foods, lacking nutritional support, overuse of alcohol because of stress, obesity because of a lack of movement and exercise. All of these result in excessive fat cells, pro-inflammation, insulin resistant.
That's a crazy list.
Yeah, it's incredible. It's incredible.
And so when we understand that as people, that all these things cause inflammation, you as a medical professional in this space, how do you go about identifying what of these is causing it? And then how do you work with your patients to try to improve it?
It is actually based on elimination. You try to tie the exposure to the symptoms. And how to do that is very extensive history taking. You go in depth not only to the patient's symptoms, but you look at their sleep. This is a big thing because I believe sleep is not only for rest and restoration. It's actually probably the best anti-inflammatory therapy. You try to get into their daily habits, what they eat, what they do for recreation, what type of work they do, what are the exposures at work or at home, any changes or difference in their mood, what ticks them off, what makes them happy, unresolved conflicts, infections, or previous illnesses, and genetics, definitely. But genetics comes last.
Yeah. So this is a process. So you work with clients or patients, try to understand that, and then over time they're improving these items, and then they're reflecting on how they feel. Is that a fair approach? Yeah.
Exactly.
Got it. So why is this not? I mean, in today's modern medicine, very rarely do I go see a doctor and they blame inflammation. Although I can tell you, there's a lot of things on this list that I know I have issues with. So, is there a reason why this is not that commonly discussed with doctors?
One word, rather than a long spiel, it's bias. We're taught in medical school in a certain way. We are not taught about how to read an article properly, how to analyze it, what makes sense and what doesn't make sense. We are geared to prescribing medications and having surgery done. Yes, this works for acute illness, but you got to look at the other aspects as well. I meant, if I have a patient with a heart attack, as an example, I won't tell him, okay, let's do your inflammatory markers, see what supplements you're lacking or what lifestyle changes we make. We have to deal with the heart attack the way it is, give him things to dissolve the blood clots, heart support, and so. But after that, we got to look at these factors. And unfortunately, because how the medical system is set up and the insurance system as well as the business of medicine, we're geared just towards treating the acute ailment, not prevention, and not preventing this as a tertiary prevention.
So somebody right now who's not feeling well, a Gen X man who's listening to this and saying, yeah, I probably have some of these symptoms here. Is there anything they can do to kind of self-diagnose and start making some improvements and kind of go through a methodology?
Yeah, we got to know what is exactly off. Is it their focus, foggy brain, mental fatigue? Is it lack of recovery after exercise, as an example, or inability to perform exercise the way they should? Is it symptoms pertaining to a particular part of the body, like the heart? Do they get chest pain? Is it shortness of breath? Is it what? Is it a problem with resilience, like if it's a sleep disturbance or what? Is it a problem more that is hormonal / endocrine / metabolic, like a problem with weight, as an example? or is it something pertaining to the gastrointestinal tract, like bloating, tummy pain, continuous hunger, inability to be easily satisfied. And upon identifying which area is exactly, there are usually what's called first tier tests done, just as general markers to see where the problem lies. And once you identify the area, you go in depth in working that up and having the specific test to it and then treating it.
If somebody is looking at kind of their habits, they're trying to resolve this on their own and they can't, and they need to go see a doctor and they want to have these specific tests.
Yeah.
Is it a general practitioner? What kind of doctor? Because you said you kind of got an inkling of holistic medicine originally to help identify that mold could be the case. Who should somebody look for?
Functional medicine doctor or an integrative medicine doctor, definitely.
Yeah, they're going to get to it much quicker.
Yeah.
Perfect. Okay. Sharif, this was great. Is there any other information you want to share with our audience about inflammation or some of the things you've seen in the past?
No, it is just I want to comment on technology and its involvement in these things. I meant, beside the wearables and things that help self-care, the development of AI now, there is a lot of applications as well as hardware, the latest of which that OpenAI came up with. They were describing it first as a faceless phone, but what it turns out to be, it's a single small device that records voice as well as videos, and it's linked to ChatGPT as well as other databases, and it can be linked to medical databases. The advantage of that, it does not only scribe information, but the video recordings can come up with operative notes. It can come up with teaching of junior doctors and surgeons, and it helps patient monitoring as well. It can work in the area of home health, as an example. And because of this interest of mine, I'm actually developing an app based on what I think are the 5 pillars of integrative or functional health. I called the CHWA because CHWA refers to a hidden syllabus. It's not something that is really obvious. And CHWA stands for sleep, cognition, heart health, weight, and activity, because this is like the functional areas that are affected by inflammation. And as I've expressed before, I think inflammation is the base of all illness, be it acute illness or...
This is hardware that you're producing, that you're developing right now?
No, it's actually a software that integrates with different wearable devices, IoT, Internet of Medical Things, together with manual input. And it processes biometric data using proprietary algorithms to deliver personalized lifestyle recommendation, targeting sleep quality, cognitive performance, cardiovascular wellness, weight optimization, and athletic output. So it lies really at the intersection of functional medicine and AI-driven wellness together with consumer feedback. And the nice thing about it, it's a scalable model that can be extended both to consumer as well as corporate wellness markets. And it can be extended towards medical tourism, coaching, and the telehealth ecosystem.
That sounds fantastic.
Thank you.
If any of our audience wants to learn more, both about either inflammation or about what you're building, how can they find out more? Is there someplace they can reach you, or where do they do their research?
Yes, it's through my LinkedIn profile, linkedin.com/Sharif Hassan. I can send you that as well as my email.
We'll add it to the notes.
info@sharifhassanmd.com. I got several websites, but this is going to be what you call the main portal of accessing that new website.
Perfect. Awesome. Sharif, thank you so much for spending the time with us. I'm going to have to look into inflammation a little bit more. Some of the things that I just chalked up as I'm getting older seems like it has a root cause that I need to explore a little bit more. So thank you for your time. Appreciate you sharing your knowledge with the group. And I think we'll have you on again because I would love to learn a little bit more about this platform, understand exactly how it's going to impact our future, because technology looks bright ahead, which is great.
I thank you for the opportunity. I really enjoyed the session. I'm looking forward to future sessions with you. And I'm going to text you the contact information shortly.
Perfect. Sharif, it was a pleasure. Thank you.
You're welcome. Thank you.